Hi there. My name is Dr. Allan Parungao. I'm a board-certified plastic surgeon and hair transplant surgeon here in Chicago. I'm going to tell you something that all hair transplant surgeons want you to know. Number one, there's no such thing as scarless surgery. And number two, the best results come when patients combine surgical and non-surgical therapies for their hair restoration. The first way of doing the hair transplant surgery is called the strip, or FUT. The FUT procedure leaves you a linear scar on the backside of your head. It's small and fine and hard to see, but there is still a scar. The second way of doing it is called FUE, or follicular unit excision. Instead of a linear scar, you're left with small, barely perceptible dots where the hair was taken. Let's talk a little bit about the medical therapies for hair restoration. When we refer to medical therapies for hair restoration, we are talking about non-surgical ways to save the hairs that you still have. The first way is through a pill called Propecia or Finasteride. Finasteride is a medication which lowers the amount of DHT, which affects hair and causes miniaturization and hair fall. The second therapy that is very commonly used is also known as minoxidil. This is a topical foam, usually 5% in strength, which is applied to the scalp once or twice a day from front to back. This has the effect of slowing hair loss and making some of the miniaturized hairs a little bit thicker. The third way, or third medical therapy for hair restoration, is low-level laser therapy. Laser therapies are used to augment the subdermal circulation and provide a better environment for hair growth. The last therapy is called PRP, or platelet-rich plasma. In this procedure, we draw blood from the arm, spin it down to the platelets, and inject the platelets and their growth factors into the scalp, nourishing the roots of your hairs and providing a better environment for the hair to grow. The most common question I get about side effects is about the pill Finasteride or Propecia. As you recall, Finasteride is used to lower the effects of DHT on your hair, which causes hairs to miniaturize and fall out. When people look online and look for side effects, the most common one that they come across is a decrease in libido. They also see that it may be associated with depression. We find this to be exceedingly rare. In fact, studies show less than 2% of men have these side effects. If you're experiencing hair loss, your next step is to get an in-person consultation with an experienced hair transplant surgeon near you. The ISHRS has surgeons across the world. We have over 1,000 members in over 70 countries who are ready and willing to help you with your hair loss solutions. Please go to ishrs.org and click on Find a Doctor. Thank you.